So what can you do? If someone is having a cardiac arrest or even like a myocardial infarction, don't try to rescue them themselves. Call for help. Even if you're in a hospital, don't try to like save them right there. Call for help, either regardless if you're a nurse or a doctor. Call for help. And that's what you should do, be it first. And then you can try CPR. And don't try CPR by yourself. You will tire out eventually. This is why it's important to have a team. So yeah, this is why CPR, don't do CPR first and then call for help. Call for help first. And this is a common thing. You probably saw CPR, especially if you like a lot of medical TV shows. I know they're doing that Doogie Howser reboot here at the med school that's coming up on Disney Plus and whatnot. But you usually say, okay, someone's heart stops, and you see everybody, all the doctors and nurses doing CPR, and then the patient revives eventually. Well, what's the actual truth behind it? So what are the actual stats? I know this is back in 2000s, but it probably most of the follow-up results are along the same lines. So in this study of just under 1,000 people, they looked at the medical records. So what we had is most people survived the arrest and made it to the hospital. But within 24 hours after staying in the hospital, just under half survived. And then in the ones that actually survived to discharge, so now they're released from the hospital, most people died, didn't even make it out of the hospital. So again, CPR is good to kind of, yeah, you don't want to withhold CPR unless they have a do not resuscitate order. But again, CPR is good to try, but don't expect miracles out of it, because again, I think Hollywood kind of distorts that. It's good to try, but don't, if someone doesn't survive it, don't take it too much. I mean, it's going to be hard, but again, don't feel like it was your fault. And what's the other thing you can do? Defibrillation. So to restart the heart. So it's kind of like pressing the power button, like say your computer froze up and you can't close the windows, you can't do Control Alt Delete. Sometimes you gotta hit the power button. Your computer is going to be very mad at you, but it restarts the whole thing again. Thing is with that VFib, I mean, look at that crazy pattern. It's like if someone's this is great. Like during office hours, there was another great analogy I thought up of. So the conducting system is like a conductor for an orchestra. If you have an orchestra or band, and all the instruments and musicians are starting to play faster and out of control, they're no longer coordinated. It doesn't make sense to keep on playing over until you finally get it together. Sometimes you just have to stop and restart everything so that everyone starts again. Or say someone's like trying to dance and keep up with music. Does it make sense to keep on dancing faster and faster? Not really. You just have to kind of stop, hit, and then press reset and start all over again. So that's what defibrillation does. Yeah, so then what we have here is our defibrillators. So yeah, or actually it's kind of funny. This is from OpenStack, so that's not English. So that was it. Defibrillateur. So that's like defibrillateur automatique, like en français. But yeah, that's what we have here, an AED. And what we have here this is what conducts the electrical charge with the defibrillator. So what is defibrillation? So you're going to this is how you do a hard reset on the heart. You apply a strong electrical current to it. So this is why it's called AED, Automated External Defibrillator. And it's going to deliver a very, very strong charge. Again, remember your membrane potentials, they are in volts. This is way beyond the scope of any of those membrane potentials in your heart. So it's going to basically just depolarize all the cells in your heart and hope that your SA node and the pacemaker cells start to pick up a rhythm again. And then they can start to set the rest of your heart in motion and maintain a constant beat. So again, it depolarizes the entire heart, hard reset, and tries to stop that arrhythmia so that you can have that normal ECG pattern again. Yeah, so you wouldn't know if they're in VFib unless they're a monitor. But one thing you can do without a V monitor is that they have no pulse. Okay, no pulse because VFib is pulseless. So that's a classic symptom of VFib. Yeah. Yep, so if you're a monitor in a hospital, you would shock into rhythm. Because again, you want to get the heart back to pumping normally, because again, the longer you're in VFib, you're not getting circulation to your brain, your heart, or any of their internal organs. So this is why the longer you wait, the more you starve all the organs and tissues of your body of blood. Yeah, so. And yes, there is a risk to tissues with defibrillation. So that's why if there's time, sometimes they shave so that you don't burn the hair and you actually have conductance on the skin of the patient you're trying to do defibrillation. So yeah, you just want to get the heart starting again, and you want blood to pump. That's what you want to happen. So you don't want to, because again, the longer the whole body is without circulation, the more tissues die. Yep. So this is what happens. You want to, and usually most AEDs, they have instructions, so they'll tell you where to place things. And I think they're unless it's like a really old AED or if it's like a very low quality model, some of them actually have built-in heart monitors themselves. And they actually have like ECG sensors so that they know if it's oriented correctly, and it won't fire unless you actually place things properly with the heart. And yeah, so the thing is that roughly you want it to be aligned with the depolarization and the conduction system of the heart. And this is why we typically see this negative electrode up here toward the right and superior, and then the positive electrode toward the left and slightly inferior, because you want to align with the depolarization of the heart. Okay, and again, this is why, and there's my anatomy slide. So here we have the base of the heart. So when you're talking about the apex of the heart, even though when we think of apex of a mountain, it's on the top, apex of the heart is where it gets pointy. So this is the way I like to think of it. Base of the heart is where it's widest. Apex is where it starts to point in most people toward the downwards and left. Yeah. Chest tattoos. Ooh, actually, you know what? Chest tattoos sounds like a good pack-back question. Yeah, if that would affect defibrillation, you should get on that real quick. Yeah, so I that's a good thing. I would have to research that, like if the metals in the chest tattoo could affect it, or. And yes, someone's talking about breast implants. It's funny, like it's that in terms of just like overall mammary glands and implants. That's another thing to consider with AED placement, like depending on the anatomy of the person. What if they have something on their chest that affects the placement? How do you compensate for that? That's actually something like, it would be nice if we had enough time, but I don't think we have enough time to cover that. But I think two of you already have good pack-back questions to ask. But yeah, this is why you roughly, if you can, and nothing's obstructing it, try to align the AED the pads as close as you can. And if you watch enough medical dramas, what do people announce before they actually do fire off and press the buttons on the defibrillator? They say clear, right? And why? Because you're delivering that 3,000, right? So you don't want anybody touching the person and getting that shock, or you don't want yourself getting shocked as well. So this is why whenever they say clear, put your hands up, step away, and then have someone do that. Because again, this is why it's important. If someone's pulseless and they're not circulating the blood, you want to restart their heart and get it up again. So yeah, that's the defibrillation, and it's an ineffective on hearts that are completely stopped. And that's another common medical misconception you see in the media. So if something is happening with the conduction system and it's not working and it's not shaking hands with the rest of the cardiomyocytes, it's not actually depolarizing the cardiomyocytes, it won't work. So this is a common myth. Like you've probably seen like in the medical drama, the beep, 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 flatline, right? So flatline or asystole, these people can't be shocked back to life typically. I mean, if they're completely flat, sometimes if they have slight electrical activity, but if the conduction system is totally gone, you can't start it up again. So this is why flatlining, this is like something you see all the time. Like I wish I gotta watch more movies where this happens. But if they're completely flatline, yeah, I notify the next of kin. It's not, you're very, very small chance. Almost like impossible to bring them back. If there is some conduction system activity, maybe, but even then it's like that means that's how long they've been without circulation. Even then the long-term prognosis isn't good.